When you recognize the need for some form of mental or emotional therapy, you will likely search the internet and find many forms of psychological treatment. One that is the most often used is cognitive behavioral therapy because it has demonstrated effectiveness for a wide range of problems such as depression, eating disorders, panic attacks, relationship problems, and personality disorders. Psychological problems are often based on faulty ways of thinking and learned patterns of unhelpful behavior. Our mind is full of thoughts every day, and those thoughts influence how we perceive and react to people and events around us. Some thoughts are conscious thoughts about what we are doing, but other thoughts are random and automatic. We are often unaware of them, but they can have a powerful, detrimental influence on our mood and behavior. The culmination of all of our life experiences result in automatic thoughts that are often based on misperceptions. These automatic thoughts contribute to things like a fear of failure or negative self-image. Some examples of automatic thoughts are things like, no one likes me, I can't do anything right, nothing ever goes right for me, I am accident prone. These automatic thoughts can lead to perpetual unhappy moods, depression, and unhealthy coping mechanisms. Cognitive behavioral therapy, or CBT, helps people learn how to identify and change destructive or disturbing thought patterns. It focuses on changing the automatic negative thoughts that can contribute to and worsen emotional difficulties, depression, and anxiety. In cognitive behavioral therapy, the therapist works with the patient to identify, challenge, and replace unhealthy thought processes with more objective, realistic ones. Techniques in CBT may include journaling, role-playing, relaxation techniques, and mental distractions, such as any healthy coping skill we choose that helps us feel better, calm down, or lifts our mood. One of the most important pieces of CBT is to learn to identify what sets us off in the first place, or what triggers us to begin thinking or feeling in a negative way. Challenging our negative thinking and feeling patterns can be difficult. It is almost as if we are trying to rewire our brain from being stuck in a negative pathway that is entrenched in a lifetime of memories. One simple way to start this is to recognize when automatic thoughts come into your conscious thinking. When that happens, ask yourself, is there proof of that? What is the evidence or facts to support that statement? Maybe you are thinking you are not good enough, which leads to feeling sad, which leads to harming yourself if you do not stop and challenge the thought and the feeling. You would say, no, I am good enough, which leads to feeling more satisfied or happy with yourself, which leads to taking a walk, doing some self-care, instead of wanting to harm yourself or isolate. The list of benefits can go on and on. The most important thing to know, however, is getting connected to a professional who can teach this, guide you, and help hold you responsible for these changes you are trying to see in yours and your child's life. Please talk with your healthcare provider about where to get help. The goal is to get to know yourself so well that you can move on and be as healthy, happy, successful, and functional as possible, even during struggles we may face in life. Together, we are building a better, healthier community.